Hi, I'm Ellis Redman, a Wellbeing Ambassador at Newport Live. This presentation is to tell you about the exciting musculoskeletal project that we are part of and how you can socially prescribe your patients. So let's start with who we are. Newport Live is a charitable trust that provides sporting, leisure and cultural activities in Newport to support the health and well-being of people in the city and beyond, to inspire them to become happier and healthier. I'll pass you over to Kenny Butler, Head of Health and Wellbeing Development at UK Active, to let you know a bit more about the MSK project and how it has come about.
Okay, this as part of the UK and Innovation Healthy Aging Challenge, so the UKRI challenge, which is administered by Innovate UK. This is a consortium that will deliver innovative industrial research. And this is what this is. This is an industrial research project. And it aims to transform our gyms and pools into community MSK hubs. So that could be knee, hip, back rehab hubs. And this Healthy Aging Challenge has been around for a few years now, and the government is looking at addressing exactly that, the aging demographic. So this project aims to do that and reduce health inequalities and the burden on the NHS by providing local, supported self-management options for people to better maintain mobility, physical function, and reduce pain through activity. There's a huge need for this. There's something like 6 million patients waiting for treatment, rising monthly, with older adults being the primary beneficiaries of NHS services. These older adults are facing huge waits. It's not just MSKs, other long-term conditions, but this is the approach that we're taking for this project. This is why we've been successful, and this consortium and your operation and your practice, and hopefully you'll get involved in this because most MSK disorders can be effectively managed without medical intervention. The people involved, the people and organizations involved in this consortium are Orthopaedic Research UK, who are the funders for Escape Pain, which is an intervention for musculoskeletal, for knee, hip, and back pain, which is a land-based option for an evidence-based intervention that is already delivered in many places around the UK. Another intervention that is part of this project is Good Boost, the people who are leading this project. Good Boost has an aquatic and land-based option for people living with musculoskeletal pain and knee arthritis, etc. And they have an AI-driven app as well that will include tailored exercises. So, for instance, with Good Boost, people could be in the pool, 5 people can be in the pool doing 5 different exercises, for instance, because it's tailored to them and their pain on the day. UK Active is the conduit between the fitness and leisure centres and this project and the policy and government. We are also delivering the active standard element of this, which is an accreditation to give healthcare practitioners confidence to refer into these spaces, into these programs. And we are also helping operators and gyms and fitness and leisure to engage with healthcare practitioners. Arthritis Action are the charity, Arthritis Charity, involved in this, and they will be running support groups and giving educational tools and training to the program as well, and to the operators. So this is the consortium, along with your gym, Newport Live, for instance, and your operation and the links between healthcare practitioners to tailor an intervention for people living with MSK problems.
Newport Live will be focusing on launching the Good Boost aspect of the project first. We hope to have this up and running in the first week of October. Here's another short clip to let you know more about Good Boost in a little more detail.
Good Boost is a social enterprise supporting people to manage their musculoskeletal condition through personalised exercise delivered on rehabilitation apps. Musculoskeletal conditions is an umbrella term that describes conditions such as arthritis, back pain, joint replacement surgery, rheumatoid arthritis, fibromyalgia, and many more. Therapeutic exercise and rehabilitation programs are hugely effective in the management and prevention of these conditions to improve pain, function, and overall well-being. GoodBoost was created with a mission to support people to better manage their musculoskeletal condition through individually tailored exercise programs on land and in water. GoodBoost is a specialist team of clinicians, physiotherapists, researchers, and engineers that have developed artificial intelligence software to power a therapeutic exercise app. To date, we've measured improvements in participants' pain, physical function, and quality of life, where participants are transforming their lives every day through being more active. The app was co-designed with people living with musculoskeletal conditions to make sure it's easy to use, even if you're less confident using a smartphone. It works by gathering information on where you experience pain or difficulty moving, and if you have a diagnosed condition. These details are securely sent to GoodBoost's clinical knowledge map, where our artificial intelligence matches your profile to exercises to suit you. You can then follow your personalised program using your own tablet or phone. After every session, we gather more feedback from you to make sure that the exercises adapt to your needs. Whether it's in the comfort of your own home or in community buildings like swimming pools, church halls, or retirement villages, GoodBoost can transform any place into a therapeutic space. GoodBoost. Move more, have fun, feel better.
Here are a couple of participant stories to show you some of the outcomes that GoodBoost can produce.
It took me 5 years to find some exercise I can do. It came quite easy and it was enjoyable and it's made a heck of a difference. I can now use my left leg to step up occasionally, and I could not do that before because if I tried to put weight on that to step up, it just collapsed. Now I can do it sometimes.
I've had a back condition since I was a child, AS, ankylosing spondylitis. It affects the spine and gradually fuses it if you don't do things. The consequence of it is I've managed to reduce the drugs I'm on and continue to do that, which is really good. The other thing is I can sleep. With a back condition, it's very different. At the end of the day, you get tired, the pain kicks in, and it's very difficult to get to sleep. It's good because you're in a controlled environment. You're not getting out of your depth if you don't want to. The exercises build up too, so you gradually build up your confidence. It's great.
GoodBoost is built to the highest standard of clinical and data quality. It is externally reviewed and audited for clinical and medical app quality. So here's how your patients can access GoodBoost at Newport Live. Firstly, they need to be aware of the project, so if you can socially prescribe them, that's great. Then they contact Newport Live via email, so goodboost@newportlive.co.uk. From there, one of our team members will pick up that email and set up a one-to-one consultation. During this consultation, we will set up their GoodBoost account on the app and complete their GoodBoost assessment on the app also. This takes around 30 minutes and asks them all the relevant medical questions to help build their program using the artificial intelligence. Once that is set up, the patient is then ready to sort of book their first session. So they can book their first session. That'll be through one of our reception teams or our app. Once they've completed their session and they're helped through that process by one of our facilitators, they're just able to book future sessions just in the generic way of going through our app, calling up or booking online. Here we have the venues that we will be running GoodBoost in. So we have the Regional Pool and Tennis Centre, which is located at Newport International Sports Village, and the Active Living Centre, which is at Newport High School, and that's in Bettis. Thank you for taking the time to watch our presentation. If you do need any additional information or have any questions, please feel free to get in touch with us. As I said earlier, my name's Ellis Redman and my email is ellis.redman@newportlive.co.uk.